Hi, this is Dr. Hamil, and I would like to share with you this acute case. 60 years old male presented with acute MI. It was done by my colleague and showed multivessel, heavily calcified. You see the LED occluded diagonal, also calcified and occluded, and there is probably this is the one of the culprits, big Ramis, also 99%. It was referred for bypass surgery, but turned down and sent to the unit on IV heparin and brought back to me for intervention. Here is the crane view, audio crane. Now here, when I brought him back, and you see there's some flow in the diagonal, which was completely occluded now after IV heparin and dual antiplatelet. He has some flow in diagonal, but you see there is complex bad lesions in those vessels, and the LED is still CTO, of course. So the plan here, I'm gonna fix this Ramis first because it's much easier than this bifurcation CTO LED, and then move toward the LED diagonal. Now the run through first did not pass through the Ramis, so I have to advance it toward diagonal, and then use PT wire for the Ramis. So here the wire ran through in the diagonal, then the PT wire supported by 2O balloon and placed distal segment of the Ramis, and then starting the inflation. So here after the inflation, and here is the stent 2534, and then here is the flow still sluggish, so I post dilated using NC balloon high pressure. You still have nice flow, but still sluggish because I think this still has small vessel disease, so I have to give him agrostat here. Now we're gonna move toward the diagonal. So the wire already in the diagonal. I did multiple inflation with 2O balloon, then the same other wire, PT wire, also supported by 2O balloon, and then here this is a crane view, audio crane, and then see advance toward the LED. Without supporting with 2O balloon, it's very hard to advance the wire, so it always need to be supported. And here the wire landed well, distal LED, and here we have inflations in the LED, and here is after. Now we have flow in the LED. We're gonna fix the diagonal using 2O stent from here to there, and then 2.5, and then we fix the LED with the 3O. So here is the first stent for the diagonal, 2O, and then pull and inflate also at high pressure, and then I'm gonna move toward the spider to see where we're gonna place the stent, and here is the measuring the length, and then 2.5 stent in the diagonal at high pressure, and then using the same balloon to post dilate and then flare the ostia. And then here we have nice flow, so I'm gonna pull the wire out of the diagonal directed toward the LED. See that? And then toward the LED, and then I'm gonna use the same balloon to flare it or dilate it across the LED. There you go. Now we can pull the PT wire out of the LED and place the stent. And here is the 3O 38 stent for the LED. And then of course we're gonna see the distal segment in the crane view. And here is after inflation. I always save the fluoro to minimize the radiation. So if you see in all my practice, I do that instead of doing cine, and then here post dilating at high pressure in the LED. And here's the final results. You see we have nice flow in the LED, nice flow in the diagonal. Still the Ramis has some distal, thrombosis. We give him agrostat and send them upstairs with agrostat. We have decent results here. All right, thank you.